The town's 13 deaths were among the topics I discussed with North Attleboro Town Manager Michael Borg and Public Health Nurse Anne-Marie Fleming on Thursday.
We had 3 early on, earlier in the month, but there was a large number that we did lose over this weekend, both at the hospital and then at our local long-term care. You know, it was really a hard thing when those numbers came out.
When someone who lives in North Attleboro is at the hospital in Attleboro, Sturdy, or at, say, Life Care in Attleboro, and they unfortunately pass away, does that count towards Attleboro or North Attleboro?
For all I know, it counts twice, but it is counted for North Attleboro because they reside, their home address is North Attleboro. That gets reported to us by the hospital. If they pass away at a long-term care, we would only know about it if they notified us. So that might be a case where it's counted towards Attleboro, but the hospitals, they report directly to us and let us know, you know, that unfortunately some people passed away.
Last weekend was an especially tough weekend at Madonna Manor.
Yes.
How closely do you work with their officials in monitoring what's going on?
Actually, almost daily. They've been working hard from way back, trying to stop that very thing that happened. You know, they put a lot of measures into place, protective measures, but you know, they are some of our most vulnerable people. They are frequently of greater age. They frequently have comorbidities. They're sick to begin with, so they're much more vulnerable. It's why it's been so important in putting the word out for people to make sure they take precautions. And we were trying to put that off, and we did well for a long time, but it's unfortunate. I think the numbers are at 308 or 310 out of 350 long-term facilities in the state have COVID patients.
Mike, during Monday night's town council meeting, you were in effect the bearer of bad news, going through all of the numbers. I did not get a chance to observe the meeting, but I would assume people were shocked at the numbers.
It was definitely a sad event for the town to lose those members of our community. And unfortunately, it was just something, though, that I had to bring to the attention of the town council. But to use that time, though, to reinforce the seriousness of this pandemic, and that it should be a call to action for all of us to heed all the warnings, to wear a mask when you're in public or in those essential places, to wash your hands frequently. So we all should double down on our efforts to prevent that from happening further as much as we can.
I know from day one you've been planning for different scenarios. As you said, worst case scenario. I know steps have been taken along the way. What are the latest steps the town has taken? I thought I read something about masks for town employees.
So we're working on, and Anne-Marie, we're actually collaborating today on finalizing a mask directive that would require citizens to wear a mask when you go into any essential business, or when you're within contact, doing business or interacting within 6 feet of another person in those essential businesses. So we expect to have that out, and probably next week it will be in place, but we're just making sure that we've done all the checks, everybody is in compliance, and it's something we can support. We want to make sure that we're supporting our local businesses that are essential and open in doing this. And also, I think it also foreshadows what reopening looks like in the future, that masks will probably be a part of that scenario.
I heard the governor during a press conference earlier this week talk about decisions being made at the local level. Are those the type of decisions he was talking about?
Absolutely, and not every municipality is the same. They don't have the same numbers that we're experiencing and seeing, right? We're not only tracking the new cases, but also the recovery, and looking for that balance, and looking at every piece of data that we can to tell us that we're on the downward curve of this. So it's good to hear that the governor's taking a perspective that, you know, the leadership in the local municipalities can give him the feedback and then take action to put in those protective measures for the residents.
I know I've asked you this in the past. How often are you in contact with people at the state level, your peers? Is it the MMA, Mass Municipal Association?
Yeah, it's daily contact, right, with our local representatives, various members of our staff, right. There is a live and flourishing group of administrators and professionals that are in contact, sharing ideas. I look at what our other peer communities are doing and take guidance from them as well as we go forward through this, and bounce ideas off of everybody I can to see if it's a good idea, you know, maybe it needs some adjustment, or maybe just not even use it at all.
I hate to ask you about this every time we're together, but I need to ask you because taxpayers are concerned budget-wise. What does this mean to the town and the services they receive?
So let me start with the services. We're going to ensure that we provide all the services absolutely necessary, from police, fire, public works, parks and rec, to every ability that we can within the current constraints of the ongoing pandemic. As for budget, it's a task that we deal with daily. We are in the budget season right now. It is something that I am deeply involved in and working with all of the key staff on trying to get our hands around the budget. Right now, the initial indications is that we will have a reduction in state aid and probably, and more than likely, local receipts as well. So revenues will be impacted by the current. So we're trying to take into that and make the best educated estimates that we can about where that budget's going to land and how it's going to position the town going forward.
How important would aid to municipalities be in the next stimulus package in DC?
Absolutely necessary. I would ask that our federal, representatives understand that every disaster takes place on the local level, right? It is the local municipalities that feel the brunt of every disaster, and this pandemic is no different, and that they should also look at what our potential needs will be.
Thank you, Mike. Anne Marie, I know there have been changes in hours over at the police station, that the school nurse is still continuing to take calls, answering questions, but those hours have changed.
Yes, they actually just reduced by 1 hour. So they were originally they're fielding the calls from 8 to 4. But what we've found is that between 8 and 9 a.m., they're getting no calls. And it's too early to actually call someone at home. I think with a lot of stay-at-home people, they're taking that opportunity to perhaps sleep a little later. So to get a call at 8 o'clock in the morning just seems very invasive. So what we did is we just adjusted. So the nurses, the first group is working from 9 to 1, and then the others are working from 12 to 4. Still having coverage, still making phone calls to be there for the citizens.
And I always give you the last word. You're the expert. What do people need to keep in mind?
As we've been saying all along, really the guidance has been out there. People need to be careful and mindful. I think because of the length of time this has been ongoing and will continue, people are getting a little impatient and they want to get back out there. So they still need to make sure they wear masks when they go out, particularly in areas when you're going to be within 6 feet of someone. If you're out there shopping, or if you're going to be, just interacting with someone for needed business, wear a mask, wear gloves, just take precautions, because you're not just protecting yourself, but you're protecting those vulnerable people. And if I may, I'd like to do a quick shout out. Next week is Nurses Week, so I just want to say, anybody out there, if you know a nurse, just give them an attaboy, because really, in the hospitals, the long-term care, and our nurses, working there with the COVID cases and contacts, they're working hard, as all our public safety personnel. So I just want to just say, thank you to all the nurses out there for what they do each and every day.
The timing of National Nurses Week couldn't be better.